Good evening, everyone. I am from SANS Foundation. I am Dr. Pratibha and I look after the Pulmonary Rehabilitation Department here. Today we have with us Dr. Bose. So, as I feel you all must be aware that we are planning to run a crash course on pulmonary rehabilitation that will be for 10 days. I have already shared the registration form in the group. Along with that, a slide presentation on pulmonary rehabilitation so that you can get a gist about what exactly pulmonary rehabilitation is. Over to Dr. Bose.
Friends, those who are in respiratory care practices, whether you're a physician or you're a pulmonologist or you're a nurse practitioners or cardiologist, I think without pulmonary rehabilitation, you cannot be called a specialist in that field, because pulmonary rehabilitation is the need of most of the chronic cardiorespiratory disease or pure respiratory disease. They need a structured, holistic program. It is something going beyond molecules, because as you know, these are the patients which is they are getting very rampant in the society, because despite optimum inhaler and supportive therapy, people are still symptomatic. So pulmonary rehabilitation makes the patient much more functional, and it improves the quality of life. And we have done more than 1,000 pulmonary rehabilitation programs. And in the post-COVID era, so we are doing post-COVID rehabilitation programs. And we are getting a lot of mental health programs also, because hyperventilation and other cognitive issues are also rampant in the society. So friends, this pulmonary rehabilitation is not only a very pulmocentric program at SANS Foundation, it's a very holistic program. We treat the disease as a whole, not as a simple hole in the body. What we do initially, we do a psychometric assessment to understand the mental health, because once you're breathless, you have a sleep disorder, you're anxious, so we do the psychometric assessment. Once the psychometric assessment is done, then we go ahead with a structure program. So component is divided into cognitive behavioral therapy, which is a mental health program. We do emotional and cognitive programs. In the emotional health, we talk about the rational emotive behavioral therapy. So wellness is a very important part of the pulmonary rehabilitation program. Then finally, we go into the disease specific. We assess the disease specific, quantify the disease based on questionnaires. We do the comorbidity assessment. We assess the severity of the disease. We take we see the compliance of the patients on inhalers and other non-invasive oxygenation support therapy. Then we enhance the muscle training through different endurance techniques, muscle strengthening techniques. But the most important part of our rehabilitation program at SANS is our specific tailor-made breathing techniques. We give power breathing techniques and muscle enhancing techniques. Specific nutrition program or structured nutrition program is very interesting. It's very tailor-made. And of course, we talk about the vestibular dysfunction, because in post-COVID fibrosis, we get a lot of vestibular dysfunction because of the chronic, bed-bound patients. They have this problem. So it's a combination of mind, body, and totally a holistic program. And it's done in a very structured way. And normally, every patient is subjected to 6 weeks of program. Normally, they are called twice a week. And each patient is given a 6 weeks program, and then we assess then we do a outcome assessment based on the score which we have designed, psychometric score. We see the wellness score, and let me tell you, even if they are the respiratory numbers remaining fixed, there's a tremendous improvement, I feel, in the cognitive health. We want the muscular health, endurance, and the best part of it, the patient feel good, the sleep improves, and outcome assessment is very good. So every profession, whosoever is into a respiratory care practice, should adopt this pulmonary rehabilitation program and avail this opportunity to learn our very innovative pulmonary rehabilitation program at SANS. And the best part of it, we do a lot of programs. We have a lot of trained people working with us. And if you get trained in pulmonary rehabilitation program, it will be a huge job opportunities for you. And also we can connect you to a lot of our patients, because you can do at home care level, because many of the patients we are not able to attend because of their what you call deconditioning and homebound nature of the disease. So it will be huge job opportunities. We can also get you a lot of jobs for professional involvement for the patients who are not able to reach us. So it's a very interesting program. It's a part of the specialty. Avail this opportunity and be in touch with Dr. Pratibha.
So friends, I also think it is a huge opportunity for medics and paramedics. And I think it's the time to buckle up and start enrolling for the program. 2 batches are already filled. Only 10 seats are left for the 3rd batch. So enroll now.
So just give your feedback how you're liking this, our digital tools, NHI podcast series, now pulmonary rehabilitation. Shortly we are coming up with the cleansing chest pains weekend series. We are also coming up. We already have written a couple of books. We are coming up with a lot of interesting programs and certificate programs. Stay connected, and if you're liking our initiatives, please forward to your near and dear ones and involve more and more people so that we can do a lot of good activities in the society. Regards, Dr. Bose.
Thank you so much.